Hi guys, it's Miranda and Jess. Today we're going to be doing what a telehealth visit would look like for a pediatric patient. So a little bit of background about this patient. Jess is going to be playing the patient. Is that they're a 6-year-old. They have difficulty with balance. They have trouble sitting up straight in class. First I'm going to ask a couple questions. So Jess is going to play the mom for the subjective part, and then we'll go into the assessment. So I hear that Jess is having some trouble at school. What sorts of problems does she seem to be having?
Well, the teachers have told me that she's not staying seated up in her chair. She's slumping a lot and like resting her head down, and she has trouble getting up from her desk and the stairs. She has a lot of trouble with stairs.
Okay.
She can't keep up with her peers.
Okay. Does she have a lot of falls or anything like that at home?
Yeah, I always just thought she was kind of clumsy, but yeah, she trips a lot.
Okay. So we're going to go into the assessment. Jess is going to play the 6-year-old. We're going to be looking at some strength things, some balance things, then we're going to go into a couple of treatments. So first thing for a core strength test, I won't do it for the sake of time, is I would have them do a sit-up test. So how many sit-ups they could do in a minute. We'll say Jess got 5. So now another core test I would do is you're going to lay on your stomach, Jess. Okay. And I want you to try to bring your arms and your legs up off the ground like you're Superman. Is that hard for you?
Yeah.
Okay. So that's looking at her core strength, which could be a problem with her posture at school. All right, Jess, go ahead and stand up for me. We're going to do a balance test. So I'm going to have her do a standing on one leg balance test. So you're going to have your hands on your hips. Can you see me?
Yep.
And you're just going to try to stand on your one leg, okay?
Okay.
Okay. Is that hard for you?
Yeah, I felt like I was going to fall.
Okay. So normally, like I said, for a 6-year-old, she should be able to stand longer than that. So she has some balance problems. Last one we're going to do, Jess, is you're going to go down on one knee. And without using your hands, I want you to try to get up off of the floor. Okay, good. So another couple things I would probably look at would be stairs. For the sake of time, we'll just say she couldn't go up them one over the other. I could also look at her coordination, so throwing, catching, that kind of stuff. It's all just based on what deficits is reported. All right, Jess, so we're going to do a couple leg strengthening exercises, okay? So I saw you had some trouble getting off the floor, so we're going to work on that. What I want you to do is, if you have a couple toys right there, do you have a couple toys you could use right there?
I have some shoes.
That'll work. You just need 2 of them, okay? 2 different colors if you can. So this exercise is going to work on her leg strength to help her getting onto and off of the floor. So she has a black and white shoe. So Jess, I'm going to give you a color. What I want you to do is you're going to lunge down, touch that color, and try to come back up. You don't have to go all the way down to the floor, okay? So go ahead and lunge down and touch that black shoe for me. Good. Now go and touch the white shoe. Make sure you're bending that leg. Go ahead and come back up. So I'd probably do 10 or so reps of that with her. I might also have her lay on the ground and reach while she's propped up on her elbows to help with some of that core strength. But that's pretty much what a general telehealth visit would look like for a pediatric patient.